The teacher, knowing the child may now speak to a specific, let's say it's a 7 or 8-year-old, and the child now is speaking to his or her friend. The teacher now knows that. So during class, the child can be paired and grouped with that same child. And then in addition, the teacher can say, do you want red or if the child isn't speaking to the teacher yet, do you want red or blue? Avoiding eye contact. No
Mhm,
answer, avoid red or blue. Tell Rebecca. And now your
mhm,
child already talked to that child. It has a verbal intermediary. Where
mhm,
prior to this, so you moved it into the school. Now you've got a verbal intermediary. So at least we've got more communication and progression across the social communication bridge. So
right,
yeah, I
right.
mean, it's always interesting for me to hear people that, we don't work every day together, obviously, but when you work with this population, you realize over the many years you and I've worked with this population, what works and what doesn't work. And,
Mhm,
making it fun for these young children and really involving them, demystifying this. I call it A&A. Acknowledge that this is scary or hard and
mhm,
assess it. It can be like a 5 out of 5 or a 2 out of 2. Or sorry, a 2 out of 5 is easier. And so I trust their feelings a lot. So
mhm,
that seemed easier this time. Maybe,
mhm.
last time, remember, so we get them to really get their feelings and that helps them gain that control. Cause I always think, and I was wondering your thoughts on this. To me, so much of this is them feeling out of control. And one of the reasons I love the bridge and the cognitive aspect of the bridge, even for little guys, they know where they're at. I
Mhm,
feel like that gives them control where they
mhm,
normally feel out of control.
mhm,
So I know I can do this with this friend in this place.
mhm. Well, I have to say that I, with younger children, I often do not involve them in building the intervention, in building the desensitization, and it happens to them. They know that I'm there in order to help them speak more comfortably. But the reason that I often do that with younger children is because it works. It works
Were
faster.
you talking younger, like 3, 4? Because a 7-year-old will know. I
A
think we're
7-year-old
probably
will know. I would say around until around 7. Yes, until around
okay.
7.
'Cause I the little guys, you're right, like, you make it fun and they do it. I always say the younger they are, the easier, it's less years they condition, so we don't involve them as much, but sometimes giving them the words, so if you let's say as they get older, you're involving them, so you're telling them who they're working with, kind of like who's gonna be sitting with them, but then what you're discussing is silent goals. We talk about that, where we as teachers, we as
Mhm.
parents set up the world for them, and the
Right.
active goals, as you're saying, are a little more reserved as the kids get older. So that's completely makes sense. And that's
Mhm.
why it's important that as adults, not only do we don't wait, facilitate, right? But we set the world up so that they can be successful.
Oh, I love that, setting the world up. That
Setting the
is
world
what
up.
needs to happen
Yeah.
to whatever degree they are involved in being part of building the plan of saying how they feel, from almost 0 with younger
Yep.
children to being really partners with teens or with older
Yep.
children. In Of course, we are leading and we know what we want, and we also know what is most likely to work.
Right. So we
They
set the
they
world up, and
what
parents
we
don't know
Mhm,
that often. They don't know how to do that. Like teachers, they'll buddy them, right? Like, here's what I say: the buddy process, small groups in the room, small groups out of the room, which we all know. But what are they doing in the small groups? How are they questioning? Where are they questioning? Who are they included when they question?
mhm.
What are they using? So all of those nitty gritties make the difference between success and not. So we have to set it up so it's all there. It's like setting the table. We know,
Well, and one of the exposures that I do in schools with teachers, this is one of my go-to for children up to the age of about 8, I would say, is a 4-week plan. I like to One of my jobs when talking to teachers, I'm sure it's the same with you, is to explain to them how significant their help will be,
oh,
how they
100%.
can be such a therapeutic agent of change, where they will be changing this child's life for the better. And that is the basis of successful learning, successful integration socially, also. So, but then I like to give them a very, very specific and short term intervention to do that. I'm
Yeah.
not asking them the rest of the year, give this child 5
I
minutes
fully
a day.
yeah.
Exactly,
Yep.
exactly.
And then you tweak. and
Exactly.
then you tweak. I always go like this. You got
I'm gonna take that. I'm gonna
Yeah,
use
we're learning all these hand motions, right? I got this and got, the hand holding. We've got the tweak, tweak, tweak. Sometimes I compare it to a tree. You've got the general strategies and interventions that work for many at
mhm,
first, but then
mhm,
it's tweaking it. You're going off on a branch and then off on a
mhm,
branch, off on a,
mhm,
and that's why it's so hard when a family calls and says, I need an IEP or I just need my kid to talk. Give me
mhm,
strategies. It's like, wait,
mhm.
who is your child? Because what works for your child may not work for the other child. And also taking into account, like, I'm going to give you an example. We have a lot of kids in our practice with comorbidities, and I think we attract that population
Mhm,
because of that whole person where
mhm.
exposures aren't always enough and behavior
Yes,
change. So you have a child with autism and they're 10 years old and they're in school. It's not just the talking, it's the social puzzle that's
yes.
so hard, and having them navigate conversations,
Mhm,
how to start the action plan, who's going to be there, what can be said, what is your answer, like,
mhm,
they need more of that and they need more activity to be a focus rather than the nuances of reading a face in conversation. So it's like
mhm.
the same with ADHD and the processing and not being able to keep up with a conversation or expressive language. So they can respond, but putting their thoughts together to have a give, take, back, forth. So knowing this, Ruth, is so important because that's where you adapt the treatment for what strategies may work better for that child versus another child that doesn't have those challenges.
Absolutely. In the initial consultation, you've got to get the whole picture because there are often things that need to be done both in the treatment that we are going to, the treatment plan that we're going to build. And again, tweak, tweak, tweak. You're building a treatment plan and then you're changing
Tweet,
it.
tweet, tweet.
Yes, yes. This could be a great dance. But you also have to think about what are their other needs. Perhaps they need to be learning to speak the language, the
Wow.
spoken language. And until then, how are you going to help them talk to friends when they're not talking the same language? Perhaps they have pronunciation difficulties. Perhaps they have a generalized social anxiety, and perhaps they have a lag in social skills and they need to learn those social skills. So you've got to get the whole picture. You've got to see simultaneously what can the parents be doing? How can I incorporate these specific challenges that this particular child has into my treatment plan? You can't have a successful treatment plan without knowing the child, without knowing his likes and dislikes, his preferences, his strengths, and perhaps there are comorbidities or challenges. So, yeah, I would like to say one other point that treating, I feel, and this is to do with also being accountable. And this is really a pet subject of mine that therapists, psychologists have to be accountable. They have to see that what they're doing is helping. And treating selective mutism is hard work. And it's hard work for the therapist who is tweaking all the time. I'm not saying, okay, you're going to come and play with me and that's going to really help you. I'm working with a teacher, I'm working with a key worker, I'm working with the parents. It's hard work, but it's also hard work for the parents, and
Yes.
it's hard work for the teachers. I mean, it's reasonably hard work for the teachers. It's not the end
Yeah.
of the world. It's doable. But when this takes me back to your original question: why does it have to affect the child's real life? And the only way it can work is when there is hard work, which is guided by the therapist of all of these different significant potential therapeutic agents of change in the child's real life. So it's hard work. It's not, as therapists, we need to think, okay, what's worked? What hasn't worked in our original plan? How has the child responded in school, at home, in the store with grandma? Let's think what worked. Let's think what didn't work, and
Yeah.
let's plan so that we will have constant improvement. That's what we want. Of course, it's not always going to work, but that is what we're planning. We're not sitting on our laurels and saying, this is working well, let's leave it at that.